Namaste. Today we have with us Dr. Mahesh Sabade, who is a senior doctor with us at Tanman Ayurvedic Research Center. So, Dr. Sabade, today we are going to ask you a couple of questions which we have received several number of times from multiple people, and we are happy to hear your views on them.
Sure.
So, the
Thank
first
you.
question being the most important and the most asked, what exactly is Panchakarma?
Yes. That's such a crucial question because everyone keeps asking about it. What is Panchakarma? Do I need to do that? All that. So, first of all, let's see what Panchakarma is. Panchakarma is no way different from Ayurveda. So, it is part of Ayurveda. It is basically a kind of treatment in Ayurveda which helps to eliminate excess and vitiated doshas from your body. Doshas is Vat, Pitta, and Kapha. So, over the period of time, we tend to accumulate those doshas, Vata, Pitta, and Kapha, through our food, through our lifestyle, and few other reasons also. So, that accumulation eventually leads to different other kinds of diseases. So, if we get rid of them, so that's like we nip in the bud and we clear doshas and we clear the body, we improve the status of the body so we can prevent the diseases. That's one aspect. And in some situations when diseases have already manifested, so the root cause for those diseases is these doshas. So whichever is vitiated, we do it, we eliminate them and we treat the patient. So that way it helps to clear doshas and heal your health, heal your condition and cure your disease.
Correct. So, talking about cleansing, is this a kind of detoxification and can anybody do it?
Yeah, so detoxification has become a very popular word nowadays, but I won't call it just detoxification because Panchakarma is, I mean, if we call it detoxification, it will be like something that we are not giving due credit to its efficacy.
Correct.
Because it's more than detoxification. Up to certain extent, when we are eliminating doshas, when we are eliminating kapha, we can say we are detoxifying, we are cleansing kapha. If we are eliminating pitta, just that part, we can say up to certain extent it is detoxification, but it is beyond that because through panchakarma you can improve your health, you can strengthen your tissues also. There are 7 tissues inside the body, so each tissue can be improved, their health can be improved. So accordingly, in panchakarma there are 5 different treatments. So each one is specifically designed for certain kinds of ailment. So whatever the ailment is, accordingly that treatment is chosen and accordingly we treat that. And at some point when we need overall replenishment, if we want to improve the health, quality and quantity of the tissues, then also we can choose panchakarma. So to answer your question, panchakarma is not just detoxification, it's more than that.
Absolutely. And talking about 5 treatments, so does one person need to go through all 5 treatments?
Yeah, that's the point everyone asks us because usually patients ask us that okay, I want to do panchakarma. So what kind of panchakarma, that will be decided by the doctor Vaidya who is treating that patient, because there are different kinds of diseases and each disease has a different pathology in it. For example, if someone is suffering from, let's say, asthma, so in asthma there is vata and kapha which are out of balance. So to treat that we need Vaman treatment.
Correct.
So like that there are 5 different treatments. So I'll just name them.
Yes.
Vaman, which is emesis. So you induce vomiting and that is beneficial for kapha disorders. Then the second one is Virechan. Virechan is like giving purgatives. So by giving purgative, you eliminate pitta dosh primarily through anus, through bowel movement. So a person would actually experience more than 8 bowel movements during that procedure. So that's how that treatment is done. The third one is Basti. Basti is enema. So rather than calling it just enema, we can call it medicated enema. So what kind of medicine, what kind of oil do we add to that particular mixture? So accordingly the basti pattern changes. How many days you give basti, what kind of basti is given. So all those factors involved in it. The reason I specified medicated enema, because enema, just the enema, word enema is popular by using soap water enema. So I don't mean just plain water or soap water, because enema or basti, when you give, so it has to have something which is unctuous, something which is oily, greasy in it. Either oil, ghee, milk, something has to be there. And giving just soap water, it's like drying for your, it's basically drying your colons. So that way, this is different. Then the next one is nasya. Nasya is like instilling few drops in your nostrils. So that is helpful for diseases which are associated with ENT, ophthalm, like all the conditions which are related to area above the neck. So that's about nasya. And the fifth one is rakta mokshan, which is bloodletting. So you do it either using leeches or you take it through syringe. Syringe is basically a way which we have adapted to. Earlier it was a different procedure in ancient texts, but this is how we do it. So each patient requires one or the other treatment. So that a Vaidya has to choose. So it's not that, okay, I'll come and get all Panchakarma done and then I'll be free from all the diseases. It's not like that. So these are the methods, these are the procedures which aid in improving the status of your health. And it doesn't only associated with doshas. There are various other factors. So you have to follow a proper diet, proper lifestyle before Panchakarma, during Panchakarma and after Panchakarma. So when we do everything in a proper way, we can certainly improve our health.
Absolutely. Thank you for the insight about
Thank you.
Panchakarma and its 5 treatments. Speaking about the colon, and you mentioned that ghee is very essential. So this is another question that is usually asked. Is it important or compulsory for the intake of ghee during Panchakarma treatments?
Yeah, so there are few procedures. Vaman, Virechan. So these are 2 specific procedures that need intake of ghee or oil. And the reason is, so what happens is whenever we are talking about doshas, like if a person is suffering from skin disease, and if the skin disease is somewhere on the foot, so we have to cleanse doshas, cleanse toxins in simpler words. We have to bring those toxins to the gut and then we have to eliminate them out. So to bring them to the gut, there has to be something that will aid in this procedure. And that's the ghee. So that's why ghee intake is important. And another question related to that which commonly is asked is that, do we need to take that much ghee? Because taking ghee is not a problem for most of the patients. But the ghee intake during Panchakarma has to be in increasing order. So the last day of ghee intake is usually a glass full of ghee.
Okay.
So that's how it is necessary and that's why we do it.
Certainly. And providing a diet plan is a very essential part, is what I am aware of.
Yeah.
So can you provide any insight about how diet plays a role in Panchakarma treatments?
Right. So we need to understand first that diet is crucial in almost everything, because diet is something which can actually either create good health or bad health.
Certainly.
So during Panchakarma, if we plan a proper diet, so it supports in the process of cleansing. It supports in nurturing your Agni. So for that, the diet or the food and also the lifestyle has to be planned accordingly. So whenever the ghee intake is we call it Ghrutapan, so that, or Abhyantar Snehan. So during that phase, the diet has to be proper. So proper in the sense, when you consume the ghee, so you have to wait till you feel the hunger and then you can have your first meal. So that's how you have to plan. And after the procedure is done, so then after also you are supposed to eat specific kind of food, specific quantity of food. And so that is so important. Otherwise what happens is it disturbs your agni and disturbs your metabolism, and that's worse than having that disease itself.
Correct. So Panchakarma again being cleansing. We've also heard of terms like naturopathy cleansing or Shatkarma in yoga. So is this any different from the both of them, or what exactly can you
Yeah.
comment on that?
Right, that's a very important question, because even naturopathy has basti. Naturopathy does all these things, but their basti is plainly with water, as far as I know, because I'm not an expert in naturopathy, but this is what I have observed. So that's not what Ayurveda approves. So Ayurveda doesn't recommend anyone to use just the water for enema, or for that matter even coffee for enema, or all sorts of things which are popular nowadays. So that's not Ayurveda approved. So from that perspective, in naturopathy they use different kinds of methods. They are way different from Ayurveda. And same thing in Shatkarma in yoga. So they do Vaman, and they have like Jalaneti, Sutraneti, those things, but they are different from Ayurvedic procedure. And there's nothing to brag about, but I personally would like to say that the methods used in Ayurveda, not just the methods, the whole procedure and the thought process behind it, it is so extensive and it is so deep rooted. So I would certainly give a preference to cleansing in this particular way in Ayurvedic methods.
Absolutely. So thank you so much. And those were all the questions for today. But to our viewers, if anyone has any questions for our doctors, you can definitely list them in the comments below. And thank you so much again, Dr.
Wonderful.
Sabde. It was lovely to have
Thank
you.
you, Yashvi. Wonderful speaking with you.
Thank you so much.
Yeah.